Hello, my name is Dante Downing. I'm a nursing student at MCC, and I'll be showing you how to do, starting a IV infusion. So first off, we have to look at the MAR and confirm my order. So we'll be doing IV 0.9% NS, 1,000 milliliters to infuse over 6 hours, and we have to ensure that we have the right patient, drug, dose, route, time, and then further documentation when I am done. And before we are going to start setting up, I'm going to ensure that we have the right drops per minute. And I'm going to figure that out by coming over here and looking at my bag. First off, to ensure that we have no particles in there, making sure there's no leakage, anything like that. And to look to see what the drop factor is. With those calculations, we come up with a drops per minute of 28. So now that I have looked at my MAR and ensured that we meet all the patient rights and that we have the right patient and ensure the accuracy of said doctor order, we are good to start with the procedure. So we have my equipment here. We have the 20 gauge needle that is most appropriate for my patient, saline flushes, saline lock, alcohol, gauze, our strip, and then our solution with the primary tubing. So before we start, we are going to do the tubing and the setting up the bag. Again, check the bag, make sure that there's no particles, nothing like that, and also ensure that the expiration date is good. It is of February 21, so we have a year until it expires. Now that that is done, we are going to start our tubing. Primary tubing, everything is good there. And to maintain sterility of the tip, I will not be touching that, but it doesn't matter because that is the cap on it anyway. Alright, and now we are going to clamp Alright. Now we are going to take off the blue cap right here, discard of that, take off the lid, discard of that, and spike the bag. Perfect. Now we will hang it over here without hitting my head. Alright. All these cords. There we go. Now we're going to prime the chamber, squeeze it, get it halfway full. Perfect. And we are going to calculate the drop factor, or the drip rate of 28. So it'll be 14 drops every 30 seconds. So we are going to do that. And fill up the tubing. Making sure that there's no air bubbles, nothing's occluded, things like that. Alright, tubing is full. Calculate the drop. that we have set the drop factor or the drip rate at 28, we are good to start the setup. Alright, now I'm going to wash my hands. I also performed hand hygiene before I started hooking up the tubing. Alright. Now I'm going to place a linen thing underneath our patient to ensure that we don't get any spillage anywhere. I'm going to come in with my supplies after I have gathered them, introduce myself, wash my hands again, get 2 patient identifiers. So hello, my name is Nurse Downing. I'll be your nurse for today. We're going to be setting up an IV for you so we can get some continuous fluids so you are well hydrated. Can I get your name and date of birth? Perfect. Now that I have 2 patient identifiers, we're going to place the patient in a comfortable position at a safe working height for me. We're going to have the arm flat and getting the most distal vein with no tattoos or no hairy areas. If there were hairy areas, we would trim it with some scissors. Now that we have placed the patient in a comfortable position at a safe working height, we are going to begin the procedure. So we're going to get a tourniquet. I'm going to place it on the patient, but I will not actually apply it until I am ready. I am going to set up my things. Cannot get this off.
It twists.
It ain't coming off. There we go. Alright. And then to maintain the sterility of the saline lock, I will have not touched this blue strip right here because this will be going into the catheter of the IV. So I will take this off when we apply it to the patient. So I'm going to put it back right here, leave it there. Perfect. Cotton balls, alcohol. And then I'm going to, on my strip, write down the date, my initials, and the gauge of 20. And also, while we're doing this, I will have also written down my initials, the patient's initials, and the date, and put this on the back of the fluid so we know when it started, who it was done by, and who it is for. And then we could also include the drip rate too. Now that that's on there, we're good to continue on. We have everything set up. Alright, and now we're good to continue. So I'm going to wash my hands again. Making sure that we have the right equipment. And before I came in, while I was at the computer, I also checked the MAR again to see if we have still a current order to do all this, which we do. I've already got my 2 patient identifiers. I have set up my equipment, donned my gloves. Find the site, Again, most distal, good vein, no hairy areas, no tattoos. We're going to clean it. Right there. And then I'd feel for a good pulse too.
Tighten this.
We're also gonna do the tourniquet part now. Perfect. And then I clean the site. I'm going to feel for a pulse. If I don't feel pulse, it's too tight, so I'm going to loosen the tourniquet. If I do feel pulse and it's good and bounding, we are good to continue. If it's not as bounding, I'll have her, or my patient, just do some exercises with her palms and her hands to get some blood flowing. Now that we're good to continue, we are going to take my needle after I just clean the site. Alright, locate my site, put some pressure up above, pull back on the skin a little bit to make sure the vein doesn't move around. Inject at a 10 to 30 degree angle. Perfect. Just like that. Discarded this in my sharps container. Alright, and now we're going to secure it. No, we're not. I'm going to flush it first. Remove the blue cap. Flush it with 5 mils of saline. Alright. Now that's done. Now we are going to secure it. With our tape. Just like so. Get our gauze, which I will need another pack. Thank you. Fold it up and get it securely right underneath, like that. Get another piece of tape. And be sure just to cover it only over the catheter part and not over the lure lock. Now that that's on, we are good to apply the strip. Now that the strip is on, I can release the tourniquet. Probably should have done that a little bit sooner, but that's alright. Discard of all of this. I'm just gonna remove my gloves and get a new pair. Wash my hands. Clean up my area. Get a new pair of gloves. And we will now hook up the patient to the IV. We'll take off the blue cap. insert. Now that we're hooked up, we can go again, unclamp it, set the drop rate back to 28. I'll count it for 30 seconds again just to ensure. Alright, now that that's done, the patient is set up. I'll ask, how are you doing? Are you okay? Do you need anything else? I'll replace the patient back in a really comfortable position. I'll lower the bed back to a safe height for the patient. I'll clean up, wash my hands again, ensure that the patient has their call light, knows how to use it, and then I'll step out, head back to the MAR, document that we initiated IV treatment or therapy, IV 0.9 NS, 1,000 mils, to infuse over 6 hours at 28 drops per minute. Patient is tolerating the therapy well so far, no IV site reactions, nothing like that. Documented by D. Downing, a nursing student at 11 o'clock a.m. Initiate, nurse's initials DD, signed.